Wellness for Life is brought to you by Perham Physical Therapy, Gothenburg Chiropractic Clinic, Mahabi Atwa Community Action Partnership, and Lakeside Sports and Pain Clinic.
Hello, I'm Matt Kaufenberg, physical therapist and owner of Perham Physical Therapy. Today we're going to talk about shin splints. Shin splints is a very common injury in those who run. Shin splints are characterized by pain along the front part of the shin. Now, it could either be on the inside of the shin or the outside of the shin. So if we look at the anatomy of the shin, so here's a drawing of the shin. So this would be the shin bone. Here's our knee. This is the kneecap and then the shin bone. And in red, we've got two muscles. This is actually our left foot. So on the inside of the shin, we have what's called the posterior tibialis. And then on the outside, or we call it the lateral side of the shin, we have what's called the anterior tibialis. Now in shin splints, you could either have a shin splint along the inner part, which would be the posterior tib, or the outer part. Rarely do you have it together. You'll have one or the other. Now it's thought a shin splint is due to the combination of a slight tear in one of those muscles, and we're talking microscopic tears, but there could be a slight tear in those muscles and in combination with inflammation of the bone. Now, it's a specific component of the bone. It's called the periosteum, or the outer layer of the bone. It's really, in essence, where the muscle blends into that bone. So a shin splint, the pain from shin splints is a combination of that slight muscle tear with inflammation on the bone structure itself. There are a couple of things I want to mention. Anterior shin pain could indicate a couple of things that are a little more serious. One of them is called compartment syndrome. Compartment syndrome is something that you actually want to go and see your doctor right away. Compartment syndrome is actually when one of the muscles around the shin actually start to significantly swell, and it causes pressure on the nerves. And that is actually could be an emergency, and you actually sometimes need to have that surgically reduced. The key component with compartment syndrome is if you experience tingling or some sort of nerve sensation, and it's typically tingling. So you'll have pain on the front of your shin combined with tingling in the foot. If you experience that, you really should talk to your doctor right away. The other diagnosis that we'll see that involves front part of the shin pain is a stress fracture. Now, the difference between a shin splint and a stress fracture can be determined quite simply. A lot of times it's point-specific pain for a stress fracture. What I mean by that is if you kind of go in there and specifically jab at one spot of the shin and that hurts, and no other spot of the shin hurts, there's a good chance that you might have a stress fracture. With shin splints, you'll kind of poke all along the shin, everywhere down that shin, and it will hurt. That's more consistent with shin splints. So those are just a couple of diagnoses that I want you to be aware of. Now, what causes shin splints? The most common cause is too much training and too soon of training. What I mean by that is we go out and run too soon, or we do too much running. So for the beginning runner, they may go out and run without warming up. They may go out and run and increase the amount of mileage that they're doing way too quickly. It's recommended that we increase our mileage by 10% weekly. So what that means is if you run 10 miles week 1, you should run only 11 miles week 2. So you're increasing your running by 10%. The problem is that sometimes inexperienced runners will increase their mileage too quickly, and you can end up with shin splints. Now, experienced runners will sometimes do the exact same thing. They will make abrupt changes in their running. Either they'll increase their mileage too quickly, or they'll change how they run. It might be that they go from running on the track to running on concrete. So you just want to be aware of that. Other causes, mechanical causes, would be what we call overpronation. So an overpronated foot would mean that that foot kind of falls into a flat position when we run. Now, if you look at a flat foot, what happens is this posterior tibialis muscle then gets stretched out with every step that you take. So eventually that muscle could break down. We could also have tight calf muscles. So, and if you have shin splints because of tight calves, that's going to typically be your anterior tibialis muscle. So the anterior tibialis, which is this particular muscle, its job is to pull the foot up. If you have a tight calf, pulling that foot up is going to be quite difficult. And so that anterior tib is going to be working a little bit too hard, and it could get hurt. Other causes would be worn out shoes, or you could have like a leg length discrepancy, or you might run on what's called a cambered road where the road is slightly tilted. Treatment for shin splints is actually quite easy. Most shin splints will resolve quite quickly within about 3 weeks. You just want to rest in ice. You don't really want to start running until walking is pain-free. You know, you can wrap your shin sometimes when you go out and running. Some people might need an orthotic to correct for that overpronation. If you're still having pain after about 3 weeks, you really should contact a physical therapist. If you have any questions about your shin splints, give me a call, 218-346-2464.
Thank you for watching Wellness for Life. Brought to you by Perham Physical Therapy, Gothenburg Chiropractic Clinic, Mahabi Atwa Community Action Partnership, and Lakeside Sports and Pain Clinic.